merger of Meharry and Metro General Hospital. And before we get into that merger and an update of that merger, why don't you give us some information so that our audience might understand exactly the population that Metro General serves and the importance and the influence of that institution.
Yeah, that's very important. And let me go back for just a minute to 1948. In 1948, Meharry Hubbard Hospital was, as now, serving a large percentage of poor patients. It's always been located, as you know, in the inner city. The majority of its patients have always been black and poor. In 1948, the number and percentage of patients at Hubbard Hospital who couldn't pay for their care was so great until it created such a financial burden for Meharry that the board voted to close Hubbard Hospital. The next day, the city council came into emergency session and out of concern for the closing of Hubbard Hospital. And they passed a resolution saying that Meharry Hubbard Hospital was so important to this community in taking care of indigent patients that it asked the Board of Trustees of Meharry not to close it and promised in 1948 that if Meharry kept Hubbard Hospital open, the city would reimburse Meharry for the care of indigent patients. Now, Nashville General Hospital, which has been there since the early 1920s, was the city's hospital for indigent care, but such a large percentage of indigent patients were taken care of by Hubbard until the city council asked that it not be closed and said the city would reimburse Meharry. City has never fully lived up to that commitment. Now, there have been years, like the early 1970s, when the city has reimbursed Meharry for almost 1/3 of the indigent care provided. But other years, like the last 3 years, when it has provided no support. So, with all of that background, you know, you look at General Hospital, it's an old, dilapidated facility. Even in the early 70s, they were talking about the need to rebuild it. And they estimated then that it would cost $40 million to rebuild. We estimate today that it would cost easily $80 to $100 million to rebuild General Hospital. So we thought, just logically speaking, you know, Meharry has a very modern facility completed in the late 80s, over 400 beds. It's not fully utilized. It provides care to the indigents just as General does. So we proposed in the late 1988 that the city, as opposed to rebuilding General Hospital at a cost of almost $100 million, close that facility and provide all of its indigent care through Meharry Hubbard. It would save the city the cost of rebuilding General. It would provide more services. Meharry has family medicine and preventive medicine that General does not have. Meharry has mental health care that General does not have. Meharry has dentistry. General does not have any of those things. And all of those are needed in the healthcare system. So it would give a building that's very modern. It would give services that are not there. And we found out later, because we didn't notice when we first made the proposal, we found out that it would also save in the cost of operation. It really would be cheaper to operate.
So the merger would make sense in a real sense. Well, now, let's talk about the introduction and some of the early opposition to that merger. And why do you think that, in view of all of the positive things that could come out of this merger, why do you think that some of the people are in opposition to it? And what were some of the your experiences before the recent update that we want you to give us?
Well, let me say this. We first announced the proposal at a Rotary Club meeting in November of 1988. I think about that because I was just at the Rotary Club yesterday. We thought that was a good setting. The business leaders in the community was there. The press was there. And we decided to announce at that setting that we were going to introduce this merger. And we explained the history that I just gave you and other things as to why we were doing it. We knew that there would be problems, and because there are a lot of barriers. There are social, economic barriers. There are area barriers. There's some people who are not comfortable in East Nashville, other people not comfortable in North Nashville. So this community has to deal with a lot of barriers, artificial barriers, have no business in existence, but they still exist. And we knew that in order for this merger to succeed, we were going to have to put those things on the table. Race is a kind of barrier because there are still people who think of Meharry as a, quote, black institution, when in fact Meharry is probably the more integrated institution, certainly one of the more integrated health professional schools in the country, integrated in administration and faculty, even in student body. But the people in this community still think of it as a black hospital, a black institution. We knew we had to overcome all of that. And I think we've had to deal with all of those issues. We've had to deal with people who are afraid to come to North Nashville, who think that it's less secure, when the fact is that Meharry Fisk campus are more secure than Vanderbilt. That's been demonstrated by statistics. that there are fewer acts of violence per capita on those two campuses than on Vanderbilt's campus. And yet the attitude of people in this community is to think of a lack of security when they think of North Nashville. So we had to overcome all of that. We had to overcome people saying, well, how am I going to get there? Just like Reverend Reasoner led the homeless march. We've been able to show very clearly that transportation will not be a problem. We've been able to show that the two hospitals basically serve the same census tracts, the same patient population, and therefore we've had to deal with these barriers one at a time. The real barrier, the first one was financial, and because there were people who argued whether in fact it was financially feasible. The board's own task force showed that it was. The Ernst & Young report showed that it was. More recently, the mayor's task force. All three have showed consistently that it's financially feasible.
Very good. And so within that